This video is about how wearing high heel shoes can affect the biomechanics of the whole body. High heel shoes became popular during the Louis XIV, and mostly women was wearing them, and also the men, mostly because they wanted to look more beautiful. 40 to 70% of women who are wearing high heel shoes, they are wearing them on a daily basis, and 50% of them experience back pain and a level of discomfort. But wearing high heel shoes can cause some biomechanical risks and biomechanical changes. For example, it increases the risk of falling. Also, wearing high heel shoes can affect the static posture of the whole body. It reduces vertical balance angle, which is the angle between the trunk and a vertical line, and also it affects the inclination of the pelvic. So it affects the static posture. Wearing high heel shoes affects the whole walking pattern. The ankle power reduces in the people who are wearing high heel shoes in comparison with those ones who are wearing flat shoes, and therefore the knee power increases to compensate. The people also who are wearing high heel shoes, they have to flex their knee angle to absorb the impact because when they are wearing high heel shoes, the ankle doesn't play any role in absorbing the shocks and impacts, so they increase the flexion angle of the knee to compensate for it. Also, high heel shoes can cause much higher patellofemoral joint stresses, which is a fancy term for this contact force, the contact force between this tiny bone and this femur bone in the knee joint. And high heel shoes can cause much higher contact stresses or contact forces in comparison with flat shoes. Also, high heel shoes can increase the activity of back muscles. Well, by increasing the heel height, the activity in the back muscle almost increases uniformly. Also, wearing high heel shoes can increase the activity of leg muscles, such as tibialis, similar to the back muscles. And also, in long term, wearing high heel shoes can reduce the length of the calf muscle. And wearing 13-centimeter high heel shoes shortens the length of the calf muscles by 5%. So in summary, wearing high heel shoes can cause some postural changes. It increases knee joint stresses, which can cause some damage. It increases muscle activity, which can create additional stresses in the joints and possibly increases the risk of injury. And also it can reduce the length of calf muscle in the long term. So when you're wearing high heel shoes next time, you might consider all these biomechanical changes.